Good afternoon or good morning on the West Coast. My name is Peter Eckert, and I am one of the co-directors for Data Across Sectors for Health. We're going to get into the content for this webinar in just a second, but I want to be clear about the information for the meeting. If you're seeing this slide, then everything is good. If you do have any technical details, the address for Jenna Frickovich, who is sitting next to me, is right there. She's at jenna.frickovich@iphionline.org. Frickovich is F-R-K-O-V-I-C-H. So for today's webinar, we have enough people that we're going to leave the webinar for the presentation. We're going to leave it in listen only mode for the participants, and then we'll try to open it up for your spoken questions at the end. And then certainly you can ask any questions in the question box that's appearing there on your screen in that dialog box up on the upper right corner. And you can ask your questions anytime, but we'll probably wait until we've done with all of the slides. And to anticipate some of your questions, the slides and an archive of the webinar will be available pretty quickly after we're done at dashconnect.org, and as will the FAQ document that responds to questions that you will ask today, as well as some questions that we've already received by email. So I'd like to welcome you to this webinar. We're very excited to open up what is round 2 of the CIC-START funding program from Data Across Sectors for Health. And I'll talk a little bit about what we're doing here. Some of you have some experience of DASH and All In, and I know that this will be new for some of you. Just FYI, almost everything that you're going to see in the slides actually is included. The information anyway is included in the brochure of the announcement, and so we're going to try not to read these slides, but we are, by going through them, letting you know what are really the important things that we want you to take away from the announcement. So Data Across Sectors for Health is a national program office of the Robert Wood Johnson Foundation. We're just now starting our 4th year in operation. And so DASH started out with an environmental scan of the world related to multi-sector community collaborations to systematically shared data. And that's been our focus since we started. It started as the focus currently. And so within the DASH program office, which is headquartered at the Illinois Public Health Institute in Chicago, where I'm talking to you now, together with our partners at the Michigan Public Institute in Okemos, Michigan. For DASH, we really have 3 high-level strategies, and one is, and they're on the slide. So one is to work with grantees and partners to discover the evidence that sort of proves the proposition that multi-sector community collaboration sharing data can improve community health. And so the second part of our work is to collect and then to disseminate successful practices and evidence that we've gotten by working with communities. And then the third is really to cultivate relationships between people who are inside and outside of DASH, but who have generally an interest in this work. And so we'll talk a little bit more about that, the structure for that. The primary big picture way that this networking happens is through All In, Data for Community Health. And you can find more about All In at allindata.org. But All-In Data for Community Health is a network of networks. And so we don't have, we're trying to keep the number of slides down, but All-In includes data across sectors for health, our organization. It also includes the staff and communities of the Build Health Challenge, the communities formerly associated with the Community Health Peer Learning Program of Academy Health, the participants who were funded by Colorado Health Foundation in a particular program there called Connecting Communities and Care, and then the Public Health National Center for Innovation that's a part of the Public Health Accreditation Board. We also are minutes away or days away from recognizing 2 new members of All-In, the New Jersey Health Initiatives and the Public Health Innovation Lab of the Public Health Institute. So All-In is getting bigger, but its basic idea is, hey, if DASH, my organization, has 10 grantees or 15 grantees, we can create a nice little network, and folks can share information and lessons and trials and tribulations together in a learning collaboration that DASH manages. But what if the learning collaboration was bigger? So that what if we included, 30 communities from Build and 9 communities from Public Health National Center for Innovation, and now the communities in New Jersey and California. There's a lot of wisdom and experience and knowledge and lessons that is inherent in all of these communities, but it's kind of tough to pull them out of the silos. And so that's why All-In exists. All-In exists to support the transfer of information and the building up of a community between all of these efforts that are happening all across the country that are generating important lessons. And as much as we think we're doing valuable work at the DASH National Program Office, we know that the lessons and the expertise and the knowledge and the solutions exist at the community level. And so our work is really about connecting communities. And so on behalf of All-In, these are really, the strategies for All-In, which you will note pretty much parallels what DASH is trying to do. So All-In is about building the bigger movement that acknowledges how important the social determinants of health are for health equity. And we're about building the larger evidence base and using the power of peer learning. That becomes important for this opportunity that is coming from DASH, through RWJF. That becomes important because, to be completely transparent, part of what we're trying to do with these DASH Kickstart grants is to create an incentive for local communities that are struggling through trying to make things happen, to connect them to other communities through All-In. And so a really important eligibility criterion that my colleague Michelle Swanson will go over in a second is membership in All-In. Now, we've already fielded a couple of questions about, hey, we are a community collaboration, but we're not a part of All-In. Are we eligible? Well, you're not eligible today, but if you join All-In by the time you submit an application, then you will meet that eligibility criterion. So we'll talk a little bit more about how that happens. Kickstart, therefore, really exists to provide just-in-time support for you and your collaboration to address a specific problem or to create support for you to address a specific opportunity. If you have a multi-sector collaboration where you're working together around sort of how do you effectively share data with each other to address a public health problem or opportunity, then that you are the target for these funds. And so the list of potential activities is on the screen now, and it's also included in the brochure. We really are interested in all phases of this work. And so, primarily we're interested in addressing how you do this collaborative work, especially as it relates to the data, the systematic data sharing piece of it. We want to know what you're learning, and if our small grant, our small funding can help you move something forward at this critical moment. That's really what it's here for. So there's a lot of different ways that you can do it. And we can talk about some of them specifically. One of the things that you can look at right now is we call this round 2 of the CIC-START program. Round 1 was really kind of a private beta prototype pilot. How many different words can I use to say the same thing? But information about the first round of the CIC-START awards is at the Dash Connect website. So you can look at the 5 communities there who are currently using CIC-START funds to move something along the way. Before I turn it over to Michelle, I want to highlight that actually it's not really that last point. I want to highlight this point. $25,000 is a useful amount of money, but it's not, for instance, $150,000 or $200,000 or $300,000, which is some of the amounts that Dash and other all-in partners have provided for projects in the past. So we don't have any illusions that you are going to spin up a brand new multi-sector, complicated, real-time data system with $25,000. It's just not possible. So what we're really looking for when we evaluate the applications is the fact that you have identified a really specific opportunity. We have just, 1 or 2 goals or objectives, a really measurable outcome, and that's how we'll know that that there's a really good match between the situation that you have in your community and what we're trying to do with the all-in network and these CIC-START funds. With that, I want to turn it over to Michelle Swanson, who's going to walk you through what we're looking for. Michelle.
Hi, Peter. Thanks. So again, echoing Peter, a lot of this stuff is in the brochure, and so we will just be touching on these things, but we also want to allow enough time for the questions and answer at the end of this webinar. So in summary, for the application, we are awarding up to 6 organizations, up to $25,000, and for up to a project duration of 6 months. The key dates: the application is due on Friday, March 23rd at 3 p.m. Eastern Time. And then the awardees will be notified on Monday, April 16th, a few weeks later, and then the contracts will be initiated on May 1st, 2018. And so the eligibility criteria, and we will be going into detail for the first one, is a member of All-In. And so I'll talk about that more on the next 2 slides. But the others are kind of in line with what we've been sharing about what we're looking for and how to grow kind of collaborations and partnerships and really this peer learning. So we're looking for active, strong relationships in 2 or more sectors that have roles relevant to specific mutually acknowledged community health objectives or goals. And we also are looking for that multi-sector shared data project component as well. And as this is, something, again, like a CIC-START, we're really looking for something specific. We are looking for a clearly defined problem with 1 to 2 deliverables. And then we're looking at a 501c3 nonprofit organization in the United States or its territories. So for the all-in, the guidelines for being an all-in member, so we wrote that they must be either a current or past member of an existing community or regional collaboration funded by an all-in partner. And this is shows you the list that Peter shared. It's us, Data Across Sectors for Health, Academy Health, Community Health Peer Learning Program, the Build Health Challenge, Colorado Health Foundation, specifically the Connecting Communities and Care program, and the Public Health National Centers for Innovation. Or one could have attended the 2017 All-In National meeting last year in April. And then also, to expand it even more, having created a profile on the online virtual platform by the time of the application deadline, March 23rd. And any of the members can apply, are able to apply, but communities that are not currently funded by the All-In partners right now will be given preference. So to join the All-In platform, we do ask individuals, stakeholders to register and create the profile at allin.healthdoers.org. And we can provide that link as well on the Dash Connect Kickstart website. So you can just click on that too. And we do ask everyone to enter the same collaborative project name. So individuals will be registering, but overall we do have also projects that we will be, that are also going to be profiled or will be posted, on the website. The picture on the top right is the All-In introductory web page interface. And then the bottom kind of gives you an example that while there are individuals, we do have projects so that people can kind of look up projects and see what work is doing. And then therefore that leads to more, conversations and interactions between, projects so that they can learn from each other. So we will be sending them a questionnaire, and then they'll be filling out details to then fill out more of this like project group snapshot. And then lastly, we will be completing a capacity assessment, and that can be discussed like when you're onboarding. And also, when you do join, we do have a lot of resources for you to look at, and then in the calendar, you'll be able to join any Hangouts where you can ask questions and learn more about how to use the platform and just participate in the collaborative. So kind of going back to just the Kickstart and the brochure and the Kickstart fund contract. So the selection criteria again is also labeled. We did name it Kickstart in a creative way, but we are looking for articulate project plans and timelines that are responsive to the START criteria. And START stands for strategic, timely, actionable, replicable, and targeted. In addition to that, we are looking for active participation in the virtual platform, but that also, includes, attending webinars. We know that a lot of you guys may have heard about us, maybe at a booth at a conference or attended some of our webinars after hearing about it on the newsletter. So those are kind of ways that we can see, just how engaged you've been and just, involved in the community and in this, in the All-In in general. We're also looking at the variety of non-health sectors represented in the collaboration, and just overall how this contract can contribute to progress in the broader plan of just shared data and improved health. We are really heavily wanting people to share lessons learned, challenges, and opportunities to the community, because it's really, this is all about just this like learning together kind of environment. And so that is one of the things that we're looking for in the selection criteria, and then also in the awardee activities and support. So if once awarded, we are looking to have the awardees update their profile, participate in 30-minute monthly calls to hear the status updates and activities, and provide any support as well. And also lastly, we're looking to provide a final report and just the ability to share lessons learned out to the community, either through maybe hosting a webinar or a report or some type of documentation. We also, as Dash, are able to provide additional support. We have been conducting low-effort in-person meetings. We're also able to support through developing communication materials, also documentation, and then also we do provide financial support for presenting at conferences or meetings. So in order to apply, the link can be found at the website connect.org/kickstart. And there are 7 sections that are listed here that are part of the application requirements. So we have just some basic information about the organization and the context, and then we have specific questions about the project, and then also looking at the budget worksheet, and we also request, for you guys to submit a letter of support, CVs, financial statement, and a work plan to see kind of what the timeline would be over the course of the Kickstart fund period. We are using RWJF's application system, and they provided tips for successful submission, which I'm sharing here, and they suggest that I share. So some of the tips include carefully noting the deadline date, time, and time zone. So for the Kickstart Fund, it is Friday, March 23rd at 3 p.m. Eastern Time, 12 p.m. Pacific Time. And then also, when you're experiencing difficulties with the application system, just contact info@connect.org immediately, and then we will be happy to help you with the application, any hiccups or whatnot. Also, complete your application online instead of offline. What is new this year is that the application actually automatically saves every few minutes as well to prevent losing your work. Number 4, submit your application just well in advance of the deadline so that any unforeseen difficulties can be addressed. And then don't create any duplicate applications to place one that you can't find. Instead, just email us at info@connect.org to help you find the original application. Multiple partially completed applications don't qualify as a whole application. And then also, when you have finished a section, just click Save Section Finished. But also, when all the sections are finished, all 7 sections are finished, remember to hit the Submit button. Many people only click the Save Section Finished, assuming that it's been submitted. So ensure that you will click the Submit button, and you should receive an email confirming a submission. And so if you haven't, just notify me at info@connect.org, and then I can help you out. And then also, lastly, just have a backup person lined up in advance to step in or submit the application on your behalf. And you can do that by inviting contributors to the application as well. But really, in essence, if there are any questions, just email me at info@connect.org, and then I will gladly help you. So I think that is what we have. And if you guys have any questions, we can open it up now. And Peter, if you want to read the first question.
Sure. I'm going to, so far we have 3 questions from the audience, and so I'm going to answer those questions. We also have a couple of questions that we got from before the webinar, and I'll answer those. And then we will bravely turn off the listen only, ask you to mute yourself unless you're asking a question, and then invite you to raise your hand, and then we will, I guess, yeah, that's how we should do it, right, Michelle? We'll still leave everybody muted, but we'll unmute individual people if they raise their hand in the little thing. So let me start with the 3 questions that we did get. Dean lets us know that when he tried to join All In, he had an error in typing his email address. And so the good news is that Melissa Moorhead, who's on the DASH team at the Michigan Public Health Institute, Melissa is the one who oversees the virtual platform that's a part of All In. And so Melissa can flag that, Dean can look for your email and get back to you. So that will take care of that. And then the next question is whether a public health department can be an applicant if it is leading and convening a collaboration among community partners. The answer is yes. If you see the eligibility section of the brochure, and we use brochure because that's what RWGF calls those things, but the document that describes the whole opportunity. If you look at the brochure under the eligibility criteria, it says that you can be a nonprofit organization or a government institution, and so in that case, public health department would be fine. I will use also the answer this question to make the point that we are looking for actual existing collaborations. The intent for this work is not sort of to gather a bunch of people in the community who haven't been working together for this opportunity. You know, as somebody who's working in community collaboration my whole life, you know, it's my experience that gathering together around a funding opportunity usually doesn't lead to long-term collaboration sustainability. But that certainly is one of the questions that we ask in the application. We have a question here from someone who says, my organization is currently a Build Health Challenge grant recipient. Does that mean that my organization is considered an all-in member? That is exactly right. Folks who are a part of Build or PHNCI or Colorado Health Foundation, DASH, and the former CHP are all existing members of All In. To echo Michelle's earlier point, though, is that if you're currently being funded by one of the All In partners, our really clear intent here is to continue to build up this national network of folks who are working around collaboration. And so if you're already currently being funded, that your application will not have as high a priority as someone who is not currently funded. Now, Build as an example, and CHP and DASH, all of us now have folks that were grantees of our project who are graduated. And so if you're a graduated grantee, then you know, we encourage you to apply. But I guess there's kind of a subtle point that we want to make here is that, you know, both because it's a relatively small amount of money, $25,000, and by the nature of the fact that we're trying to build All In, we don't think about the Kickstart grants as being continuations of other funding. You know, sustainability is a really tough nut to crack, and we know that. But you know, the answer to sort of a project that has been completed, you know, is that you're probably not going to be able to just kind of pick up where you left off with our grant funds. And so we do encourage folks who are former grantees to apply, but just to know, we're really looking for the Kickstart funds to be addressing a specific problem that you think that your collaboration can get to in 6 months with $25,000. This is also a good time, and Jenna, let's put this on the FAQ. This is not the last time that Kickstart funds will be available. So for example, you know, the first round of Kickstart, we funded 5 community collaborations, and they're about halfway through their 6-month period. We hope to get 6 more community collaborations in this round. We hope to, in 2018, to do at least 1 more round of Kickstart grants with new communities. And so I would say, if you are interested in Kickstart funding and in All-In membership, but you think that the opportunity isn't really quite available right now, but it might be in 4 to 6 months, then one thing to do would be to consider holding off, not applying now, but planning to apply the next time. I can guarantee that we'll have at least one more round of this funding available in 2018. Conversely, we'll be making our decision about how many communities are going to get funding, and you may apply now and not be funded, but that doesn't mean that there wouldn't be another avenue for your application in round 3. All right, the next question, where will these slides be posted? So the slides will be posted at Michelle, can you show up the next slide? So I think that shows the answer to that question. Yeah, so if you have questions that you'd like us to address, send your questions to info@connect.org. The FAQ, these slides, and a link to the archived webinar will all be located at a page on the Dash Connect site, and so you'll be able to find it there. Let me ask a couple. There were 3 questions that we got before we started. We sort of addressed a couple of them. But I just want to say one more time, because I admit it's not immediately clear if you're kind of haven't been paying attention to All In yet. We hope that you will in the future. But the question is, what is the eligibility criteria mean for being a member of All In? So in addition to all the communities that joined All In as partners, there are some communities across the country over the last year who have joined All In as unfunded communities. And so that means that members of their collaboration have joined up with All In. They have signed up for our newsletter. They have come seen us when we present at meetings and at conferences. Some have actually even presented with our support. And so All In membership is intended to represent the ability of communities to connect with each other. And so, if you are interested in All In membership, this is now the time to join. Now, obviously, the attraction, the possibility of being funded under Kickstart will bring some members into All In, but we are also hoping that folks through the Kickstart process will hear about All In and will recognize that there is value in access to other communities around the country who are trying to do what they're doing, the resources that we have, and the many ways that we try to connect through the learning collaboration. We do a lot of webinars. We host in-person regional and national meetings. We do conference calls. We publish. So there's a bunch of stuff going on. We think it's relevant to a lot of communities. We hope it's relevant for yours. The last question that I have that we got before the meeting was, I can't find the application on RWJF application site, and that is correct. This is, though DASH is an RWJF National Program Office, and the source of funds for Kickstart is RWJF. For the case of this opportunity, DASH is the organization that is funding these awards, and so you start through us, and then you connect to the RWJF site through our link. This is not posted on a general RWJF site because membership in All In is one of the eligibility criteria, and so we didn't want a flood of folks applying who really wouldn't become eligible. So that's all the questions that we have. And so what I'd like to do is invite those of you who are on and listening. If anyone has a question, there is a little icon with a hand and what looks like 4 fingers and a thumb. And if you can click on that icon on the panel on the upper right of your screen, you should be able to hit that and raise your hand, and then we can recognize you. Oh, and so we have a question from, let's see, I think. Okay, Kitty, go ahead, please.
Hi there. So I'm from San Diego, and I'm the backbone for an accountable community for health. We were also a part of the Academy Health Project last year in partnership with our Health Information Exchange. As a nascent backbone entity, we are a brand new 501c3. Currently, the only funding we're using towards our ACH goals is the Accountable Community for Health money we received from the California project that's going on. Because of that, because of how new we are, and because of our small amount of funding, but very, very robust set of activities and multi-sector partnership that we are deeply into in year 2 here, we primarily staff up through consulting contracts with really smart people who live here in San Diego, who are all committed to the end goal of creating a accountable community for health. So I was wondering if we definitely have a very specific need to solve in the next 6 months that could move us forward in terms of our approach to using data to support the accountable community for health. But would it be okay to use those dollars on consultants that support the project, staff the project?
Yeah, yes, thanks a lot for that question. It's a perfect one for us to answer. Yes, it is appropriate to use Kickstart funds for consultants. In fact, that really is the intent, and I guess we need to make that clearer in our communications, because it's a relatively small amount of money, and because the duration of this project is, we really don't expect that it's going to be used for much staff time. It's more likely that you've identified a technical consultant or someone who has expertise that helps you to fill in a gap. And so I'm thinking of the existing 5, 3 or 4 of them, I think, are using most of their money for consultants. I will say also that with that, because the field of multi-sector collaborative data sharing is relatively new, a lot of the expertise really is still within communities that have been working in this area for a little bit longer than folks who are new to it. And so, we would love to be able to support projects that are leveraging or supporting other communities that are doing work that would make sense to be transferred or replicated elsewhere. So I think there's some real opportunities there, and so yes, that both makes sense. It sounds like it makes sense for you, but it's certainly within how we think about this project.
Great, thank you.
So let me see if we have other. All right, Natalie, I'm gonna unmute you. Please go ahead. Oh, you're still muted yourself. Natalie Martin, I have unmuted you, but it looks like the system is telling me that you're still muted. All right. Natalie, I'm sorry that we can't hear you yet. If you want to type your question in or send it as an email afterwards, we will follow up and that answer will be posted. Oh, there you go. Natalie, it looks like you're live. Do you want to go ahead with your question? All right, that doesn't appear to be working, so let me continue to scroll through, see if we have any other questions. All right, we have had another one written in. Is there a cost to becoming an all-in member? Well, it's kind of a yes and a no. There is not a financial cost to joining all-in. And so, individuals and members of organizations that are all a part of a collaboration, everybody can join in all-in, and there's no cost associated with joining. We do make it clear, though, that a volunteer association like All In does succeed or fail based on the contributions of members, and so we encourage people to join All In, to sign up for and read the newsletter, to attend a webinar, to participate on the platform, to look at the resources, to contribute to resources, to ask or answer questions on the platform. This is all, honestly, it's a test to see if we can create something of value that's not related only to getting cash philanthropy, but really where people benefit from the relationships that are available to them through All In. So, to the extent that time is money, and we all know that it is, the cost is folks deciding to spend a little bit of their time participating in All In. All right, no more written questions. And let me just check one more time to see if we have any more hands raised.
I see Sonia Kim with her hand raised.
Fabulous. Thanks, Michelle. All right, Sonia, please go ahead.
Hi, Sonia Kim, Alexandria Consulting. We're actually an open source technical solution provider, and we're per se not a nonprofit, but we've been working with a lot of communities that are nonprofits. So if we were to actually apply, is there a way that we could actually co-apply where we would have one of our partners that is a nonprofit who would actually be the primary, I guess, applicant? Because we're actually the ones who kind of help lead the communities to come together with the solutions. So I'm just wondering what our best solution would be in applying, since we're the ones who kind of lead the communities in putting together the applications.
Yep. So that is that's a great question, and an obvious one, it seems to me. The eligibility criteria stipulate that it does have to be a public entity or a nonprofit entity that applies, and so as a for-profit entity, you could not apply. But certainly, if you were partnered up with an organization or a collaboration, they could apply on behalf of a project idea that would include you as one of the partners. Does that make sense, Sonia?
Yes, that makes sense. I was actually trying to unmute me and it wasn't cooperating with me. And then as a follow-up question, I guess there are multiple partners. So could you speak to how we could best determine who the primary applicant should be? I'm just trying to get an idea of, what the criteria, the selection criteria is, and who would be the most appropriate applicant for the primary.
Right. Well, hopefully we've written the eligibility criteria and the selection criteria so that the answer to that follow-up question is addressed there. I mean, speaking as someone who applies for grants, I try to write my applications as closely to the criteria as I can, and so there is information embedded within the description for the selection criteria about really kind of what we're specifically looking for. to your point about multiple organizations, we are looking for real collaborations that have been around for a while, who've been working together, who aren't necessarily gathered together around funding, but are really gathered around a shared sense of community mission. And so we're not, of course, suggesting that funding isn't important. We know that it is, but we're looking for communities that are organic and are existing already. And so I think it's up to you to select the applicant that kind of would best represent what you're doing and what you're working on.
Perfect.
Okay.
Thank you.
Sure. All right. Michelle, have we seen anybody else who has raised a hand? It looks like not. All right.
Do not either.
Okay. And just to repeat the answer to the earlier, the slides will be posted at our website at dashconnect.org. And so there will be a link on the front page to the location of all of those documents. My staff doesn't usually like me to promise something more, earlier than 2 days out, but we're very interested in making this information available to you as quickly as possible. So I'll just say that we'll commit to making sure that the slides, the archive, and the FAQ are all live by tomorrow. All right. Dean, just to let you know, I've seen your follow-up, and we will follow up with you. All right. I think that's it. This is great. We're very excited about it. We'll call this to a close. I want to thank you for your interest in the Kickstart program and in data across sectors for health and all in data for community health. This is really exciting work, and it's definitely the right time to be doing it. And we're eager to read your applications and be able to help some of you move this work forward in your community. Strongly encourage you to ask questions at info@dashconnect.org and look for the answers to be posted to the FAQ document within 24 hours. Thanks to everybody for your time and participation, and we'll continue to be available at dashconnect.org. Thank you.
Thank you.